Today I want to talk to you guys about the difference between type 1 diabetes and type 2 diabetes. And over the last few years, several years, things are just changing with how people are being treated, how people are being diagnosed. And so, I got a little bit of a pet peeve as far as the testing that's being done on these people that are struggling with blood sugars. And so first, let me just kind of talk about the main differences between type 1 diabetes, also known as insulin-dependent diabetes, and type 2 diabetes, also known as insulin-resistant diabetes. And so, even just 8 years ago when I got in practice, we almost never saw adults being diagnosed with type 1 diabetes. It's typically known as a juvenile diabetes, and you're either born with this condition or you get it very early on in life. Basically, it's an autoimmune disease. So autoimmune, when I say autoimmune, basically what that means is your immune system, which is your body's army, it's designed to fight foreign invaders. That immune system becomes aggressive against your own body. So you've heard of diseases like rheumatoid arthritis, lupus, multiple sclerosis, Hashimoto's, thyroiditis. These are autoimmune diseases, and your immune system can tag different parts of the body and start to attack it. So with type 1 diabetes, what happens is the immune system attacks specifically the beta cells in the pancreas. So your pancreas is a gland that secretes many different hormones. The alpha cells in the pancreas will secrete glucagon, which will help to raise your blood sugar. The beta cells will secrete a hormone called insulin, and the insulin is what will help to process that sugar out of the blood and get it into the cells where it belongs. And so again, we typically see type 1 diabetes with very young children, or you're born with it. And so with that condition, you're going to be taking insulin injections, you're going to be doing insulin therapy or have an insulin pump attached to yourself for the rest of your life. Now, type 2 diabetes, also known as adult onset diabetes, is an insulin resistant condition. And so what that means is that the pancreas is still secreting insulin like it should, but for many different reasons, which we're not going to really discuss that in this video, but for different reasons, your body starts to resist that insulin. Therefore, the sugar, instead of getting out of your blood, instead of getting out of your blood and going into the cells, it stays in the blood. Therefore, you get high blood sugar. Now, the body is brilliant. So the early stages of this disease process, your body will turn as much of that sugar into fat as possible. And so that's why you can tell by looking at certain lab markers on a basic lab panel like triglycerides. When your triglycerides start to go up, it's telling us most likely, well, number one, you're either eating just way too much sugar, way too much complex carbohydrates, or you're starting to develop that insulin resistance. And so what happens is when your body turns sugar into lipids or fat, triglycerides are made during that process. And so again, high triglycerides means that you're making more fat, and you're either making more fat because you're consuming way too much sugar, or your body's just not able to utilize that insulin properly. So what I've seen, especially the last couple years, is adults are developing type 1 diabetes, meaning that their pancreas is beginning to not secrete the insulin properly. Now, the only way that you can find out whether you're a type 1 and type 2 is by proper testing. And guys, this is one of my pet peeves because, I don't care if you're seeing a general practitioner, if you're seeing an endocrinologist, regardless of what kind of doctor you're seeing, they're still doing the basic blood sugar panel. They'll look at your fasting glucose, which gives a snapshot of what your sugar was the moment your blood was drawn. And then they'll also run a hemoglobin A1C marker, which gives us an idea of what your blood sugars have done on average over a 90-day period. Now, based off of those markers, the A1C, the CDC has set the regulations from 4.8 to 5.6 is considered a normal A1C. Yet the research is very clear that at 5.3 is where damage starts to occur, especially to the brain. That's when we'll start to see shrinkage of the brain. So again, when I run my A1C markers, my ranges are a little more strict because again, I'm not looking for disease. I'm looking for optimal function. And to have optimal function, optimal blood sugar control, we want that A1C to be between 4.8 and 5.2. Okay? Now, the CDC says at 6.4 is when they diagnose you with diabetes. At 7.0 is when they consider you an out of control diabetic. Okay? Now, the markers that are ran on you, that's all they're looking for. They're tracking your blood sugars. Now, if you're in the pre-diabetic range, basically what they tell you is try to lose some weight, try to eat better, and try to do some exercise, and let's hope that it doesn't cross over to that diabetic range. But if it does, don't worry, we're going to give you a drug to start to force those blood sugars down the best we can. Now, this is where the problem comes in, is because if you're an adult and your blood sugars go up, they automatically consider you a type 2 diabetic. So you're put on type 2 diabetic medications like metformin, glipizide, glucophage, a lot of these oral pills, right? Now, a lot of type 2 diabetics over the course of time, because of what these pills are doing to you, you get to the point to where you have to take insulin injections in order for your sugars to stay under control. Now, that is different than becoming a type 1 diabetic. And so the types of labs that I run on my patients is much more thorough because, again, I'm looking for function. And when I run tests on my patients, my goal is to normalize function. And so in order to normalize function, I've got to know where the dysfunction is occurring, right? And just by looking at a fasting glucose and just looking at hemoglobin A1C, that doesn't tell you where your body is dysfunctioning. Now, with a type 1 diabetic, we need to know what the function of the pancreas is doing. And so it's really just two markers that you run. Number one is an insulin. Number two is what's called C-Peptide. Now, insulin is a good marker to see how much insulin is in your system at the moment your blood was drawn. But again, the C-Peptide has a much longer half-life, so the C-Peptide marker is a much more accurate picture of exactly what the beta cells are doing inside the pancreas. And so, for example, I was just working with a client yesterday. That's what kind of triggered me to do this video today, but I was working with a client yesterday. 3 years ago, he was diagnosed with type 2 diabetes. He was put on 1,000 milligrams of metformin twice a day. A lot of abnormal symptoms from the metformin, a lot of diarrhea, indigestion. He's getting a lot of sugar fluctuations, but generally, no matter what he does, and this was his frustration coming in to see me, he's like, Doc, listen, like I eat good, I exercise, I'm staying away from the sugars and the carbs. No matter what I do, my sugars continue to slowly creep up. When he was first diagnosed, his A1C was at 6.6. After making a lot of changes and getting on metformin, now 3 years later, his A1C is at 7.7. So again, a tremendous amount of damage is occurring to this gentleman, and yet his doctor is now wanting to prescribe another oral medication to try to force these blood sugars down. Now, in this video, we're not going to talk about what these blood sugar medications are actually doing to the body, but at the end of the day, they're designed by the manufacturers to treat a type 2 diabetic to force those blood sugars down as close to normal as possible. Well, with this gentleman, his pancreas was not secreting hardly any insulin at all. And so therefore, the medications he was taking were not being effective. And so this gentleman had to understand that even getting sugar from fruits, and certain vegetables, his body just could not handle that. And so initially, yes, we've got to completely remove the sugar from his diet, but we're going to go through a process because knowing that his immune system is attacking his pancreas, we've got to start running tests to find out why his immune system has become out of control. So guys, you need to be tested properly in order to find out why it is that your blood sugars are abnormal.